Welcome to Get to the Root, the podcast that's redefining what health benefits should be. I'm your host, Dr. Erica Armstrong, founder and CEO of Root. Here we explore the category we've created, root cause health benefits, a smarter approach that uses advanced lab screening and functional medicine to reverse chronic conditions and lower healthcare costs. Each week, we sit down with forward-thinking employers, innovative brokers, and change makers who are transforming healthcare from the inside out. If you're ready to move beyond sick care and build a healthier future, you're in the right place. Let's get to the root. Welcome back to Get to the Root podcast. I'm your host, Dr. Erica Armstrong, and today I'm here with our VP of Engineering, Allen Ahner. Welcome, Allen.
Thanks, Erica. It's fun to be on here.
I thought this was a fitting next episode. Since our last episode, I was talking with Dr. Emily, who's our Chief Medical Officer, and Root is very much both a tech company and a healthcare company. And so I thought this is a perfect next episode. And just to give the audience a little background, Allen and I met about 2.5 years ago, right after Root was formed, and I was looking for a founding engineer with deep experience and many years of tech and in different areas, and especially in health tech, but also someone I could really communicate with. Health care in general is complex, and a lot of communication has to take place between patients, or what we call members, and clinicians, and really just putting that picture together to make sure that everything is accounted for. And so since then, we've been communicating every day very closely for a tech/healthcare company. And Allen works very closely with our clinicians every day in building what we call RootOS. So first things first, Allen, what is RootOS?
Yeah, so RootOS is our operating system that we use at Root. It is designed for functional medicine and designed by clinicians. You hit it right on the head when talking about working with clinicians every day. I think that's a critical piece in building something like this. Healthcare has a lot of different software and a lot of software that's been around for a long time. And with that, yeah, it's very expensive and it's set in stone and designed for traditional medicine. We're able to use EMRs, EHRs, that kind of out of the box for functional medicine, but it's not designed for it. So that's what RootOS brings to the table. It brings the member side of things that we want to deliver, and then also the clinician side of things. So it's a single place for all of Root to come in and operate on.
Yes, core to our actual operations, and we couldn't do our job without our technology that we've built from scratch. And I think you hit it on the head there when you were mentioning the out-of-the-box softwares. And if you are working with an external party, it's very hard to make changes, whereas you make changes in real time. When we get specific feedback, and then we have the ability to really design the software to make us more efficient and make our members more happy.
Absolutely.
And so what is it like working with clinicians every day? Did you think you would be doing this when you went into engineering?
No, but I've always had a strong sense of wanting to work with other people and work outside of just technology. That's where I think the pure value of technology lies, is with everyone else and working more efficiently and bringing that to the table. I really enjoy working with clinicians. It's what we need too. That's the key component. That's our secret sauce, if you will. Because without that, I'm just building things that I think we need, or from a technical perspective works, but it's not necessarily optimized for clinicians or for our members in the way that they're working. It may be technically sound and it may work just fine if you have to click through all the buttons, but is it easy? Is it intuitive? And a lot of EHRs, EMRs, especially on the member-facing side of things, are not necessarily that way. They're cumbersome for good reason, but they just lack that focus on exactly what we're trying to accomplish with functional medicine.
Exactly. So instead of a software company trying to do 30 UX interviews with people that are not actually using the software yet and guessing what's going to be adapted, and clinicians being able to use technology has always been a huge pain point in healthcare, and the clicks and it not being user-friendly. If clinicians don't want to use it, it's not going to work. And that's one of the key things about the way our business model works, is that sometimes the feature requests are coming directly from the clinicians because we know that it will improve our workflow and improve the experience for our members. I'm thinking back to when we first launched RootOS. This was February 2024, the first feature with lab recommendations.
Yeah.
And back then we were a very small team. So you and I were doing a lot of the product, still are with the help of AI. And you had this very clear diagram and presentation and training for the clinicians. And that moment always sticks out in my mind because we had a group of 9 clinicians, doctors and dietitians who had clearly could take off using the software. And that just doesn't happen in healthcare. Usually you go through 3 months of training to figure out, and then you still get your tech tickets that, linger, and you don't quite fully grasp how to use this efficiently.
Yeah, that's a key ingredient in what we do. We release every day, at least once. And these changes are hopefully subtle and small, so they're incremental. And I think that really helps as well. We're not just dumping a load of features all on them all at once. We're slowly building this up, and it makes the training a lot more simple as well.
So in your opinion, Allen, how does RootOS help us deliver consistent, high-quality care at scale? And we can get into talking about how we use it to help scale up with employers too.
Right. Yeah. It starts from the very beginning with onboarding, whether we're integrating with TPA through EDI transactions for healthcare claims, essentially. Sometimes that's like a CSV. Sometimes we're working with an API. Sometimes it's SFTP. But we have a number of different ranges of how we get that initial data. And that's important for their name, their date of birth, their gender, basically all their demographic information that we need to create their patient chart and start working with them. So instead of having to manually enter those in each time, we're getting those data or that data in real time or close to real time. So we can create the user record, we can create the patient chart, depending on what employer features they have enabled and are paying for, they might automatically get the root cause panel ordered directly as soon as they start. So all that's just automated. There's very little human intervention there, and that's a key ingredient for scaling. And then we get to the asynchronous requests for scheduling your own virtual visits or sending back a wellness plan or getting your lab results. All these things are available in our storefront. We're able to just check them out and purchase them like any other product. And then the clinicians will get all that information.
But I think the biggest thing in all of this complicated tech that you just explained is everything in one place, which was one of the reasons we set out to build Root in the first place. There was no operating system for functional medicine, and everything in one place, like in general in healthcare. Your member dashboard with connecting with the clinician and then the employer setting, so that we can have a lot of flexibility in how we work with employers and what features they want turned on, and everything syncing for their employees. Those are all really important parts of RootOS that help us scale. And so in particular, what parts of the employee journey are most improved by RootOS? And I want to hear your opinion, and I'll chime in too.
Sure. Yeah. I think the number one part there is the flexibility that we provide for integrating into either their healthcare plan directly or augmenting it and supplementing it with something else. But we have a sponsored allowance feature where you're given a certain amount for the entire year that you can spend here at Root, whether it's supplements or virtual visits, labs, or maybe the employer wants to pay for everything. We're able to invoice that all after it gets used, and it's a very seamless journey for the member at that point.
The transparency there is just unmatched, knowing exactly what's covered at the time of ordering. I think it's unheard of, that level of transparency that RootOS helps provide. I'm glad you said that, because I was going to say something different. And I think in my more clinical mind, it's staying engaged in between visits, which is when health happens, and having that platform built in with all of our resources and our dietitians being live and doctors being live on there, and even in a group setting to pop on and ask us questions, to recommend certain things within RootOS that have linked to direct resources that were built in-house. Everything is very much one message, one consistent message. I think a lot of times in health and wellness, you get so much noise and so much conflicting advice. And sometimes even like when I was in other settings, you recommend some kind of printout and it says something on there like, oh, I didn't really want it to say that. And just the ability to really customize it for the individual based on the things that we've built and tested in-house.
Yeah, there's just lots of it that I think that we're just building really great thing here. Yeah, kind of got lost there, but
it's easy to, I think, with the volume of things that we've created, but it's always been for one core mission, which is to bring sustainable and validated functional medicine to the world. And we've had that mission since I met you 2.5 years ago. Mm-hmm. And although we've shifted, we still work with individual members all the time, but the vast majority of our members that come in sponsored by their employer. And even with that shift, the core technology hasn't changed. We've had to add a lot of employer-specific features that help us scale and help us meet employers where they're at in their journey and their budget. And we work with all different types of employers and different sizes as well. Anything that you want to leave the audience with, Allen, that you're really excited about for the new year that we're building at Root?
Yeah, I am really excited about where we're moving with AI. I feel like our team has really embraced it, and specifically the AI lab interpretations that are customized by a clinician, but it just saves so much time from having to comb through all those little tiny details and still implement our own clinical protocols that are completely custom to us. And it's also going to be like a consistent way to message. It will have more of a template almost for the way these things are getting sent back out. And I think it's just really going to improve our efficiency and allow us to scale at a really massive level. So I'm really proud of our team, especially for embracing it. We'll make sure we're doing this in a very safe and efficient way, but it's really exciting in general, even from the side that our members will never get to see, just from how we're able to build it and use it on behind the scenes.
The timing of AI couldn't be more perfect with the timing of other things happening. Everyone needs a solution for our rising healthcare costs. And now consumer awareness of functional medicine is so prevalent that people are asking for this benefit. And then you add in AI and it makes it so scalable. And it's like this perfect timing for all things to come together. I'm really excited about 2026 for those reasons as well. And I know all of our clinical team is actually excited too, which is maybe not always the case to be excited about new technology from a clinician standpoint. But our dietitians, I know, are very excited about being able to use AI to help generate the personalized meal plans. We have so many meal plans based on certain conditions and certain customizations, and that's really going to speed us up there and provide a very valuable resource to our members. And then on the physician side, some of the clinical efficiencies, the things that they don't really enjoy doing are going to be augmented, and they will still keep that one-on-one relationship. It'll actually just be less distracting with AI there. I'll say AI in the loop instead of human in the loop because,
right.
Yeah. So thank you, Allen, for shedding light on what we're building on the tech side. This is the first episode we've done like this. Very exciting for next year. For our audience, if you're interested in experiencing RootOS as an employer, we have a For Employers page. You can fill out a demo form.
Thank you so much for having me.
Thanks for being here, Allen. Thanks for listening to Get to the Root. If you enjoyed today's episode, be sure to subscribe and share it with someone who's ready to rethink healthcare. You can learn more about Root Functional Medicine and our work with employers at rootfunctionalmedicine.com. We'll see you next time, where we'll keep challenging the status quo and getting to the root of what really drives better health.